pair of shoes. They are ugly shoes, uncomfortable shoes. I hate my shoes. Each day I wear them, and each day I wish I had another pair. Some days my shoes hurt so bad that I do not think I can take another step, yet I continue to wear them. I get funny looks wearing these shoes. They are looks of sympathy. I can tell in others' eyes that they are glad they are my shoes and not theirs. They never talk about my shoes. To learn how awful my shoes are might make them uncomfortable. To truly understand these shoes, you must walk in them. But once you put them on, you can never take them off. I now realize I am not the only one who wears these shoes. There are many pairs in the world. Some women are like me and ache daily as they try and walk in them. Some have learned how to walk in them so they don't hurt quite as much. Some have worn the shoes so long that days will go by before they think about how much they hurt. No woman deserves to wear these shoes. Yet because of these shoes, I am a stronger woman. These shoes have given me the strength to face anything. They have made me who I am. I will forever walk in the shoes of a woman who has lost a child.
I think the first miscarriage that I experienced, not by myself, I was very fortunate, but a friend of mine who tried for 10 years to have a baby finally got pregnant, and she wasn't, very far along, and it was very hard, but she went on to have another child, and it was sad. And then I had another friend who was 9 months along, and the baby died before it was born, and it was awful. And I can still remember she didn't want any contact with anyone, and it was so hard on me because I was her best friend, but she didn't want to talk to me. And the only thing that I could do was, I just felt I had to do something, and I sent her a telegram because she was out of state. And I just remember going on with my life and going in a mall and seeing pictures of babies, and it was just awful.
My wife and I been married for a year and a half, and we got exciting news that we were pregnant with our first child. As time went on, we were getting more and more excited, and when it came time to go to the doctors to have our sonogram to see everything was going all right, there wasn't really anything in there.
We were left with a lot of confusion because they said, well, maybe it's just too early, we're not sure what's to come back in a week or come back in 2 weeks, and we were left with this sort of feeling of not sure what was going on and disbelief. And then through that week of waiting, we kind of built up hope again, thinking, of course, this isn't happening to us. And we went back, and it was happening to us.
Well, the way hospitals deal with it, we were basically told the situation and given choices on how we wanted to deal with it. And then once everything was taken care of, that was it. They were just like, okay, bye.
I would say that there's a real lack of education in medical school and in nursing school about how to handle perinatal loss. I wish I could say it's better now than 25 years ago when I went to school, but I don't think it's quite better yet. It's still kind of sometimes a taboo topic that's brushed over, that really is maybe written about a little bit in textbook, but really the emotional side is very underexplored and under-taught in schools.
Someone who's never gone through it really doesn't understand it at all, and it's hard for them to talk to somebody who's gone through it.
Certain things were said that to some person may have been their way of trying to make things better, but it actually really hurt my feelings, and now I think of that sometimes when I talk to them.
at least it wasn't further along. I think that was the comment that really upset me a lot. Kind of discrediting the loss.
Any of the groups that we have, whether it be the Footprints on the Heart or the Hopeful Hearts or the Heart to Heart, I think I want women to walk away with hope, with validation for the way they feel. If I had to rate it, I'd probably say validation. I think women walk around with truly the feeling that they've lost their baby. They've lost something very important to them in their life. But because women are forced to go back to work after only a couple of days, because society says such stupid things to them, I think because they question themselves. They really know that they feel like they've lost their baby. They know that their world has been turned upside down. But the rest of society doesn't help them validate that.
A miscarriage, you don't just lose your baby. You lose a lot of things. You lose the innocence and naive feeling of pregnancy, and that everything, as soon as you get a positive, everything's going to be fine and perfect and great. That's gone. That's totally gone. And you lose the ability to just go day to day and not think about things like that. I mean, I don't have one day where I don't think about the loss. And that, I feel, is not necessarily a weakness, but I don't know if it's a strength either. It's just how it is now.
For a person who's never experienced a pregnancy loss, you don't even think that a pregnancy loss could even occur. But then when you've had a pregnancy loss and then you get pregnant again, you kind of suddenly are thrown into a world. All your hopes and dreams that used to be so carefree are no longer carefree. They're kind of rocked with a lot of anxiety and tension because you're always fearful that it's going to happen again. And I think that's the problem. People feel very robbed of the innocence of pregnancy, and it's just not fair. So I think that people just need to know that it does hurt to lose a baby, no matter how far along, whether it be days or weeks or months. A pregnancy loss does hurt and should be recognized as any other loss. I think that what I would like to see happen is just constantly educate society that, you know what, miscarriage, early pregnancy loss hurts. It hurts just as much as any other pregnancy loss or any other death of a child.